to our next speaker, it gives me absolute great pleasure to introduce a great colleague, a friend and fellow GP, Dr. Sally Lewis, who I know most of you know, has really driven the value agenda in Wales, and you're going to talk about the value impact of fracture liaison service. Thank you, Sally.
Thanks, Maina. Prynawn pawb. Good afternoon, everybody. I don't have any slides, and I'm not going to say very much, but what I'm going to say is important because the relationship between value-based healthcare and the work that you're all doing in fracture liaison services is critical. It's critical to the continued focus on fracture liaison services, its funding and its development. And so hopefully I'm just about to explain why that's the case. So what is value-based healthcare? Well, it's really just a delivery mechanism for prudent healthcare and all of those concepts that we're all very familiar with. It's about a laser-like focus on improving the outcomes that matter to people and trying to understand those outcomes better. Because if you think about it, we don't really use patient outcome data on a regular basis to guide our decision-making in healthcare. And it's also about sustainability in healthcare because we have global unsustainability of healthcare systems. It's not just Wales, it's also Australia, the US, all of Europe, because we're spending more and more and doing more and more to more and more people for longer and longer. And that's great, of course, because we've got new technologies, some of which we've heard about today. But the sky is not the limit in terms of the available resources that we have. And that's not just financial resources, of course, it's human resources. So as more and more of us are older and living with multiple comorbidities, if we carry on delivering services in the models that we're used to, we just simply won't have enough of us to look after everybody that needs looking after. And of course, we also want to provide care closer to home. So there's three key things I want to talk to you about today. One is, why does value-based healthcare focus quite a lot on secondary prevention, of which fracture liaison services are a great example? A little bit on the feedback from the workshop this morning, because I thought there were some really insightful points made from the tables in the room. And finally, what are we doing to support INDA in the Welsh Value in Health Centre? So first of all, why does value-based healthcare focus on secondary prevention? Well, value is about a patient and public perspective on the system, not a service focus. So it takes us from prevention through early diagnosis to timely and optimized intervention and on to really practical approaches to supportive care and on into palliative and end-of-life care where that is relevant. So it makes sense we need to have balanced allocation of resources across that whole pathway. And it also makes sense that we max out on prevention, doesn't it? Because obviously the highest value thing is not to develop a condition at all, as we've heard today. But persuading cash-strapped health boards to invest in primary prevention is quite hard, isn't it? Because it's got a long time horizon for the benefits. So we've really tried to focus on secondary prevention because if we do secondary prevention really well, whether that's in bone health or whether we're talking about alcohol liaison services, we're preventing harm very quickly in the short term. And that's great for patients, but it's also really helpful for health organisations who are trying to reduce acute healthcare utilisation, which is so costly. So that is why secondary prevention approaches, such as fracture liaison, are so important. So on to feedback from the workshop. I think we can look at value in three ways, at three levels in the system. The first is at the level of the individual consultation and our interactions with our patients. And it's really important that we have that person-centred approach, asking people what matters to them and having goals and preferences elicited. So do people prefer to have their care closer to home? What are their issues with their medications, as we've already heard quite a lot about? And also, what are special characteristics that we need to take account of when we're designing our services? So we had a great conversation with colleagues from the Alzheimer's Society on one of the tables this morning because clearly people living with dementia often have a high risk of falls and of fragility fractures, but how are we making sure that we're really attending in a holistic way to their needs? And that goes beyond formal healthcare, doesn't it, quite a bit? The second is at the level of the pathway and the attention to detail on pathway design, and that, that Kasim's point, I think, about the relentless focus on improvement to processes. And we can only do that if we're capturing data and outcome data and going back and back and back and understanding, are we improving outcomes? Are we making the best use of our resources? Are we really making the best use of our resources? Do we really need another member of staff? Can we get another member of staff? Or do we try innovative approaches such as the one that Professor Stone was talking about earlier in self-administration of denosumab? I know I'd be a nightmare if somebody tried to prescribe me a bisphosphonate. If I took it at all, I certainly wouldn't do it with all the, all the instructions, and certainly not every week. So, we really need to challenge ourselves on the status quo, and are we doing things in a way that could be improved or not? So that relentless attention to detail on pathway design and monitoring linked to outcomes. And then the third thing is obviously more at a population level and understanding the impact that we're having overall, and are we going in the right direction, even to just stabilise the fracture rate across Wales. And we had a lot of conversation around utilisation of resources, so that might link to the self-administration method of administering denosumab, or it might be about how we reallocate resources across pathways, and we've heard how difficult that can be, where an intervention over here creates a saving over here, but you can't access those savings to reinvest. Well, my challenge, is there anybody from finance in the room? No, so next year, right, we're going to have finance in the room, because in the Welsh Health Boards, there is no reason why there cannot be a corporate function around reallocation of resources across a pathway. I know budgetary silos are a problem, but there is no reason why there can't be a corporate finance function that tackles this. I can say that because there's nobody from finance in the room. But seriously, finance colleagues in Wales are bought into the idea of value-based healthcare. So they should be here alongside us at these conferences, helping us with service redesign and resource reallocation, because we've had all the evidence laid out in beautiful Technicolor today. So, finally, what are we doing to support INDA? We know INDA's an inspiration, right? So you can't say no to INDA, can you? That's the thing. But we're trying to do two things. We're trying to support the driving of impact, because we know that when you get wonderful work like this, you have an initial flurry and everybody's terribly excited, and then goes back to the ranch, and it's hard, isn't it? You do that, it's the hard miles of implementation. And what you need is support and continued focus from the centre to keep the momentum around that implementation. So in Welsh Government, Judith Paget now chairs a board called Value and Sustainability Board. And bone health is one of the first high-value pathways that board will have a focus on. And that board will have a focus on metrics that track the implementation of your work across Wales, and which will be regularly reviewed in government meetings with health board executives. So it's not going to be just about 4-hour waits in ED and how long people are on waiting lists. Important though those things are, we'll start to have people talking about, real outcomes linked to the work that you're doing. So that's really, really important to keep that focus so that we can support the delivery of the aims by September 2024 and beyond. And it also keeps a focus on some of the innovations that we've heard about today. And then the final thing, again, it was something which Kasim mentioned a lot about in his talk earlier, which is how we use digital and data. So how do we use digital technology to maintain connectedness between patients and specialists when they may be far away, or between different services? Or how do we ensure interoperability so that you have the data at your fingertips to understand how your services are performing? Now, data and digital in Wales is generally underinvested in, I would say, and we need to be really showing the value of digital and data in an integrated way to the clinical service planning, so that, again, we can get the tools that we need to support that work. So at the Welsh Value in Health Centre, we're trying to illustrate that by our wonderful data team who are here today, working with INDA to map pathways, do dashboards, come up with metrics that are feasible for health boards to measure. But it's just the beginning, isn't it, INDA? It's just the start. So I think for next year's conference, finance and informatics around the table as well, and then we've got everybody in the room then, INDA, and it'll be irresistible. So thank you very much.
Thank you very much, Sally.